You are listening to part 45 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome to Time Monk Radio.
Hi, Gemini. I'm so glad to be here with you in our continuing exploration of the 7 medicines, one of my very favorite topics.
And we are so happy to have you here. Thank you.
You are welcome. Together, we are helping to reclaim herbal medicine as people's medicine and to really put healthcare back in people's hands. We are looking at the 7 medicines: serenity medicine, story medicine, mind medicine, lifestyle medicine, alternative medicine, pharmaceutical medicine, and high-tech medicine, to get an idea of how we actually can feel more in control of what's happening to us. And we are deep into the next to the last medicine, the 6th medicine. Pharmaceutical medicine use drugs. And we've cast a wide net so that I include things like supplements as drugs, essential oils as drugs, something that can't be made in your own home from something that you can pick nearby, in my definition, is a drug. If you can make it yourself or if it grows out of the earth, it isn't. And then we've narrowed down to look at specific drugs and the difficulties with those drugs and some herbal allies that we could use instead of those drugs. In fact, we're going to be looking through a number of things. We've already looked at herbal antibiotics, herbal antivirals, and the difficulty with the antibiotics and antivirals that we currently have. And we are, for the past couple of weeks, looking into pain and painkillers, over-the-counter painkillers, opioid painkillers. We're going to be looking at blood pressure-lowering drugs, anti-cholesterol drugs, sedative drugs, sleep-inducing drugs, anxiety and depression drugs, antihistamines. We're certainly not going to look at every drug available, but we are going to look at some of the main categories of drugs here together and see how we can go back, to alternative medicine, how we can go back to lifestyle medicine, and even how we can go back to mind medicine, to belief medicine. When we were last together, we were looking at an article from AARP magazine called Control Your Pain and Take Back Your Life. New research and innovative non-drug treatments offer hope to millions. And I mentioned that when I did a survey last year of my students asking a broad variety of questions about health concerns, what virtually everyone checked was pain. And this article says we are a nation in pain. Some of it is temporary, some of it is chronic. Here's what the latest research tells us about that. First of all, don't let it start. Don't get into pain. Now, certainly there are acute and traumatic pains in which we say, hey, well, I certainly didn't mean to X, Y, or Z. But for a lot of chronic pain, you know, as well as I know, what's going to prevent that. And that is get moving, get walking, get doing things. The most common pain is joint pain, and moving is the best way to keep it way, way at bay. And then, interestingly enough, be more specific about your pain. I'm, in fact, very glad to see this in a mainstream article. As an herbalist, we are, in fact, quite specific about different kinds of pain and different kinds of plants that can deal with different kinds of pain and different kinds of personalities experiencing those different kinds of pain. In fact, I often say that I feel like the kid who came to school with a box of 64 crayons, while the people who have the drugs have the box, with the standard 12. They have their standard things to use, and so we think of nonsteroidal anti-inflammatory drugs. We think of painkillers in very broad strokes in modern drug-based medicine. And here's a mainstream article saying, is it inflammatory pain? Is it dysfunctional pain? Is it neuropathic pain? These are different kinds of pain. You need to be aware of them, and you need to treat them differently. And number 3, you are not crazy. I find this in talking to a lot of women, especially as the decades pass. When I was first interviewing women about menopause many, many decades ago, women were talking about something that we called hurts all over then. As time passed, and those women, many of whom were tranquilized and told it was all in their mind, did indeed finally receive a diagnosis of fibromyalgia. So whatever it is that you're experiencing, of course it's in your mind. Everything that happens to us is in our mind, but it's not just in your mind. Something is also going on if you are experiencing pain. That doesn't mean your mind might not be able to change it. Your mind could very well be able to change it, even if it's a pain from a specific physical trauma. Your mind can still change it, but you're not in any way crazy. Treat it right away. Don't let pain shrink your brain. Your brain actually shrinks when it's under stress. When it's under stress from pain, your brain gets smaller. When it's under stress from a poor diet, like a vegan diet or a raw food diet, it shrinks. So once it is in that contracted state, it's easier for the pain to become chronic. So take effective care right away. Also, we now know that pain, when we allow it to become chronic, very easily leads to depression. Chronic pain can reduce the volume of your brain by as much as 11% and age you by about 20 years. We have seen this in people with chronic low back pain, people with fibromyalgia, irritable bowel syndrome, and chronic headaches. So, what are we told next? We are told, check out some non-drug treatments. So here we are very much on the same page. The mainstream approach is indeed becoming more holistic. You're not going to find it at holistic doctors who are usually just pushing what I call soft drugs. But there are alternative approaches that have, especially when it comes to dealing with pain, shown some quite remarkable results, including acupuncture, cognitive behavioral therapy, meditation, spinal cord stimulation, deep brain stimulation, reflexology, radio frequency nerve ablation, prolotherapy, monochromatic infrared therapy, homeopathy, and real-time functional magnetic resonance imaging therapy. There's a lot of non-drug ways that the medical profession is now recognizing as useful and an actual way that we can help reduce pain. Reflexology, which is pressure applied to specific points on the hands, feet, or ears, was found to reduce pain by 40% in the vast majority of people that it was tried on, and for most of those people, it was as effective as drug therapy. Needless to say, there are no side effects from reflexology. Most health food stores still sell the same laminated cards that were in health food stores that I worked in the 60s and 70s showing the reflexology points. Those of you who read my books know that I am a great fan of homeopathy. And when it comes to pain, my personal experience has been that homeopathy, specifically arnica at various dilutions, and arnica gel is absolutely a wonder worker. Now, I love the plant arnica as well. And here the herbalist and the homeopaths agree absolutely and that is any time there's any kind of muscular, skeletal pain, anytime there is trauma, anytime there is surgery, anytime something has impacted the body in this way, arnica is going to relieve the pain, relieve the swelling, relieve the bruising. Jim and I, have you ever had occasion to use the homeopathic arnica gel?
I have, actually, yes. And I had some lower back pain, and I put it on there, and it was pretty good at relieving it.
And pretty quickly as well.
It did relieve it, actually, very quickly. I was surprised.
Most people find that the arnica gel, you can see and feel visible results usually within 2 minutes or less.
I would agree with that.
And, we urge moms of toddlers to keep it around because toddlers are always smashing themselves into things. And a little arnica gel is soothing, cooling, and really gets rid of the swelling, the bruising, and the pain. Arnica, those little homeopathic pellets, can be used before and especially after surgery or accidents, and even long after the accident to help relieve the pain. When I was fairly new to homeopathy, my friend Rena Neeson, the herbalist and homeopath in Geneva, Switzerland, was here visiting, and my friend Pam had been thrown off of a tractor and had hurt her back. And this was months previous. And she asked Pam if she had taken homeopathic arnica, and Pam said yes, but when she said what dose she'd taken it, Rena didn't feel that that was a sufficiently dilute, which means stronger, dose. And she had with her homeopathic arnica at 1 million, which is a very, very dilute dose, and she gave that to Pam. And within 5 minutes, this chronic pain that Pam had had now for months was completely gone. And what Rena said was, if you tried a homeopathic remedy for pain and it hasn't worked, try it at a more dilute dose. You may be more sensitive than you think you are. Homeopathy has 100 different remedies for headache. Remember what I said about being the one who gets to come to school with the box of 48 crayons? Have a headache? Oh, the homeopath has a remedy specifically for your headache. So if you haven't talked to a homeopath or investigated homeopathy and you're in some kind of pain, this might be the time to open that door and see where it takes you. Acupuncture is said to work by triggering the body's natural endorphins, and it has shown itself to be most effective for people with that chronic back pain, that low back pain. There is a lot of question in terms of being able to establish whether or not acupuncture works as mind medicine or whether it's actually working as, we might call it, old high-tech medicine, the actual breaking and entering of applying a needle. We could also say that acupuncture is alternative medicine, stimulate and sedate, because it intends to stimulate and sedate energy in the meridians. If you are in chronic back pain and you live in a place where you have access to an acupuncturist, the acupuncture, no herbs needed, may be something that can really change your relationship to that pain. Meditation reduces pain by teaching your brain how to alter activity in the 4 pain processing areas. Long-time meditators have far less chronic pain and are much more adept at dealing with acute pain leading to less use of all kinds of pain-relieving medications. Does it work even if you're already in pain? Yes, it does. And it doesn't have to be, you don't have to burn incense and light candles and ring a gong and have a guru and look at a mandala and chant a mantra. Simply setting aside 5 minutes at a certain time, within a certain time, every day to sit quietly allows your brain to create and nourish pathways of calmness so that when those episodes of acute pain, of traumatic pain, which indeed fall into virtually every life happen, that we have a way to move through it without resorting to a lot of very heavy medication. Cognitive behavioral therapy can help people in pain correct the way they think. It's kind of an interesting way to put it, but basically what cognitive behavioral therapy does it asks us to recognize, to cognate our own behavior, to look at our own behavior and to see if there are ways that our own behavior is causing us pain. When it comes to physical pain, all right, Feldenkrais, of course, was a great one in terms of cognitive therapies for that. Alexander and his Alexander technique also taught us how to use ourselves, how to look at and be aware of how we use our bodies. But this, of course, it goes into our self-defeating behaviors as well. The therapist in a cognitive behavioral therapy setting helps us to understand what it is we're doing, what kinds of thoughts we are nurturing and caring for in our own minds, and how, if we want to, we can change those so that we experience less pain in our lives, less emotional pain, less angst, less physical pain as well. Some of the non-drug ways to relieve pain. Meditation, of course, is serenity medicine. We're looking at a mainstream article about non-drug treatments, and certainly some of them are non-drug treatments the way we would think of it, but some of them are also high-tech medicine. So rather than going back through the medicines, they are actually going forward into what I would consider more dangerous medicines. So meditation would be serenity medicine. Reflexology would be alternative medicine. Cognitive behavioral therapy, we could say, is probably lifestyle medicine. Acupuncture would, again, be alternative medicine. Homeopathy would be mind medicine. But when we start looking at things like spinal cord stimulation, in which an electrode is implanted in the space around the spinal cord, then we must admit that we are not going back in terms of treatment. We are going into more dangerous treatment. Especially, I was a little horrified to read that this kind of surgery is used to help failed back surgery syndrome, where back surgery has left a person in worse pain than before. And so one of the non-drug options is to implant an electrode there. You can tell that I am thinking this is not the way we generally want to go. Deep brain stimulation, which is another invasive procedure, involves putting electrodes into certain brain regions to stop the sensations of pain. It has actually been used for more than 50 years, and we don't really have a really good idea about exactly how it works. So, again, this is a non-drug way to deal with pain, but not the way that I would like us to go, as is radiofrequency nerve ablation, a simple surgical procedure that uses a microelectrode to destroy the affected nerve. It reduces pain by 50 to 80% in most people and is unlikely to cause complications. Interestingly enough, I do know several people who have been in chronic pain and have chosen this and were very happy with their choice. So when we move into high-tech medicine, there is still reason to talk to people, to find out what the outcomes are, and especially 5 years and 10 years down the line, how do people feel about those outcomes? Prolotherapy is also called sclerotherapy, and it's a non-surgical treatment that is permanent relief for disc and joint problems. It's based on the belief that musculoskeletal pain is somehow connected to ligaments and tendons that are not in good tone, which causes misalignment of bones, joints, and muscles. Treatment involves the injection of a slightly irritating solution into the affected joint capsule, which causes inflammation. So again, we are in high-tech medicine here. That inflammation is supposed to lead to healing, which then leads to regained strength and stability, to improve function, increase range of motion, and relieve pain. And doctors who use the therapy claim a 90% success rate, although some patients require periodic booster shots to get them through. Monochromatic infrared irradiation comes via a device that delivers pulses of infrared light to damaged tissues via flexible pads placed directly over the targeted area. As these particular wavelengths of light penetrate deep into the tissues, blood vessels absorb the light's energy, and that stimulates the release of nitric oxide. The light itself is invisible, but the effects are readily apparent. Enhanced blood flow, improved sensation, and regeneration of tissue. This painless procedure has restored sensation in 93% of patients in 8 separate clinical trials, and it is used by the U.S. military to speed recovery from soft tissue injuries in elite soldiers. Hospitals and nursing homes are currently using it to hasten the healing of pressure sores, and it is generally known by the name of anodyne. It is especially useful for patients with any kind of nerve impairment and can speed up healing of most wounds and deal with chronic pain. It is not, however, serenity medicine, story medicine, mind medicine, or lifestyle medicine. We are past the great divide when we are talking about these kinds of things. And while they are certainly within the realm of things that we might want to use, we, I think, would be better off to start at the top of the list, to say, with my chronic pain, rather than have the nerve destroyed or have an electrode implanted, what would happen if I used acupuncture? What would happen if I used meditation or homeopathy? I understand that many people wait until they are in such a severity of pain that they feel that alternative approaches might not help at that point, and yet that has not been my experience or the experience of thousands of other people. So even if you believe that you've let it go too long and that now only drugs or surgery are available to help you, I am suggesting that that is probably not the case, that we can look at what alternative medicine has to offer, and we can even go back from there and look at serenity medicine and mind medicine and understand that we become healthier by making those choices, whereas we become unhealthier when we engage ourselves in using drugs and high-tech medicine. One of the reasons that I look at drug medicine as the first grader who came to school with the standard 12 colors is that the kinds of pain-killing drugs that are available are pretty broad. Basically, what we want with a medication is that it should act only on a particular target, in a particular way, in a particular place, but that's not what we have. And if we think that's what we have, we are severely deluding ourselves. Lidocaine is an anesthetic. It can be applied topically or injected, but it doesn't just numb pain. It actually targets sodium channels. And it doesn't discriminate between sodium channels related to pain and sodium channels of all other nerves. So when lidocaine is used, the entire area is numbed, not just the part that we want to. And yes, it does block sodium channels in the heart and is in fact sometimes used to treat irregular heart rhythms because of that. Aspirin, ibuprofen, and their kin inactivate enzymes that promote inflammation, but those very same enzymes protect the stomach from the acid that it produces, assist in the functioning of your kidneys, help your blood to clot, and so when you take those drugs, you increase your risk of ulcers, kidney failure, and cardiovascular problems. The chronic pain drug pregabalin, which is prescribed under the brand named Lyrica for pain and seizures, hits widely distributed calcium ion channels. There are lots of these channels in the brain, so when we take these drugs, they cause dizziness, drowsiness, and other problems. And then, well, we talked about the opiates, including Vicodin, OxyContin, and morphine. They work on cellular machinery found not just in the spinal cord and the brain, but also the digestive tract. So they cause nausea, constipation. They also affect the breathing as well as being highly addictive. Now, we have found a new pathway for killing pain. It's NaV1.7, and it is found predominantly in peripheral nerves that work in the outer territories of skin and muscle. And we found it in some children who appeared not to be able to feel pain, and it might provide some relief, and so far with few side effects, to people with the kind of pain that persists when peripheral nerves malfunction. So there are not a lot of ways that modern medicine has to deal with pain, but there are a lot of ways that herbalists have found to deal with pain. And when we come back next week, we will look at how we can use herbs to help us when we're in pain.
Thank you so much, Susan. This concludes part 45 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Milk Radio.